Let's cover hair transplant post-operative instructions and frequently asked questions about what to expect and what you should watch out for. I invited my team to partake in this video. Hope you enjoy meeting them.
Let's review the medications that are required for your post-operative aftercare. After the anesthesia wears off, you might feel a little sore. In that case, we usually recommend taking the over-the-counter Tylenol or Tylenol Extra Strength. If that fails to fully alleviate the discomfort, you may take the Percocet that will be sent to your pharmacy in advance. In order to prevent any possible infections, you will also be given a 3-day course of antibiotic called cefadroxil that you will be taking twice a day for 3 days. In case of a penicillin allergy, the antibiotic will be doxycycline. Also, the next day after the surgery, you will start applying the over-the-counter antibiotic ointment twice a day to the donor area only. Very important to not apply it to the newly transplanted hairs in a recipient area.
The most important message after surgery is don't rub off your grafts. This is really critical, and it seems so obvious, right? If you rub the grafts off, then they're not going to grow. However, it's actually difficult to keep that in mind after surgery because you're going to be numb and you're going to have this tendency to, bring your hands to your head, and you have to remind yourself not to do that. It's really important. The way you sleep matters because you don't want your hands getting close to your head because you could pull the grafts out. So that's really critical. Everything else is secondary, and think about it. Clinics have all types of different instructions, and if there was only one way to recover properly, then we'd all have the same instructions. But the fact that we have different instructions means that there's many different ways to take care of post-op areas after surgery. So the most important thing is don't rub off your grafts. And the grafts will be most vulnerable during the first 3 days. After that, they're much more anchored in and more difficult to disrupt.
As far as sleeping, we like the patient to sleep elevated the first 2 nights, preferably with some pillows at about a 35-degree angle or in a recliner if you have one at home. We like to do this for 2 reasons. One is to prevent further swelling and to protect the grafts from any incidents of rolling, etc. We ask the patient to place a towel on the pillows because the donor area can bleed, and so it can be a little bit messy. And we also recommend that the patient use a neck pillow, one of those traveling neck U pillows, because this will help control the neck from rolling too much and preventing accidents. As far as activity, we like the patients to sort of let us know what kind of activities they're into, especially if it's working out. We say no physical activity for the first 6 days to prevent sweating, swelling, and any possible graft damage. Also, after the 6 days, then at that point you can resume regular activities, be, light exercise, etc. After 14 days, 2 weeks, the patient is okay to start regular exercise routine, weightlifting, etc. After 21 days, we recommend that the patient can swim, whether it's in the ocean or in a pool. One of the things that the patients ask very frequently is, how do I cover my head? And so we always send the patient home with a surgical cap, but we do recommend and prefer it open to air for healing purposes. To prevent any accidents with the cap, we want to make sure that you hold the cap at the front and then grab it from the back and then pull it up and away from you and away from your head. Be careful because we want to prevent you rubbing your grafts out after surgery. The baseball cap or any other types of hats could be worn after 2 weeks once everything has healed and the scabs have fallen off.
Let's talk about caring for and cleaning the scalp. Right now, I'm going to discuss how to take care of your donor area. The day of the procedure is considered day 0. You will not do anything that day. You can expect some bleeding for the next 1 or 2 days. Light bleeding, nothing to worry about. It's completely normal. So for the next 5 days after the procedure, you're going to be applying ointment directly onto your donor area, nothing else.
Now, to continue with caring for and cleaning the scalp, let's cover the recipient area. In this case, we're going to be talking about the scalp. Post-op day 0, there's really not much to do. Post-operative day 1, there's going to be a liquid spray that is provided to you, and that typically has plasmolite and ATP solution, which is the same solution that your grafts were swimming in during the surgery. So you're going to have this in a spray, and you're going to spray your recipient area every 30 minutes minutes to 60 minutes, starting with postoperative day 1. So that's the morning after your surgery. So you do that every 30 minutes to an hour, and you want to basically run through the bottle in the first day. If you have some left over into the second day, that's fine, but that's not critical. On postoperative days 2 through 5, you'll have a basin. You'll fill the basin with some warm water in, say, the bathtub. You'll take some baby shampoo, mix it in with the warm water, and a gentle pour right over your head is all you need to do once daily, starting about 48 hours after surgery. After you've done the warm water and shampoo basin rinse, you'll then take some regular warm water and do another rinse just to get the soap out, and then you can either pat it dry, or to keep it extra safe, you can leave it to air dry. On postoperative day number 6, you're able to shower. You can let that shower current hit the recipient area, and at that point you're going to start to work out your crusts. So from days 6 to day 14, we want you to work out those crusts daily by lathering the baby shampoo over the crust, and that's important. So it's not necessarily a firm rub, but it's a lathering motion that allows you to get those crusts out a little bit each day. By the end of day 14, we want you to have all those crusts off. When the recipient area is the eyebrows, for example, or the beard, you have to be much more gentle and careful. So from postoperative day 0 to day 5, we tell patients do not get the areas wet, because the beads of water can actually pull on the grafts, and because of the acute angulation of the grafts on the face, you can actually pull the grafts out prematurely, and that would not be good. So keep it dry until postoperative day 6, in which case you can shower normally, and again, you'll start to work out those crusts each day.
Let's discuss frequently asked questions.
After hair transplantation surgery, should you avoid sun exposure? The answer will be, for the first 2 weeks, it is advisable that you avoid sun exposure. However, you can put on a hat which provides adequate protection.
Some patients report numbness, tingling, or similar sensations around the area of the top and the back of their scalp. That's absolutely normal, and it takes anywhere between several weeks to a few months to resolve on its own.
Many people ask if swelling is normal during recovery. Swelling is expected to happen after the first week after the procedure, especially if the hairline and the temples were worked on. You can experience the swelling to come down on the side of your face and also accumulate on your eyes. Swelling will usually resolve after 1 week.
My hairs are falling out after surgery. Will they grow back? But of course they will. If the hair transplant was performed well, of course the hairs will grow back. However, remember that the hairs fall out before they come back in. So you can experience, even as early as 5 to 8 days after surgery, that some of those transplanted hairs can start to fall out. Don't panic. These are just the hair shafts. The hair follicles remain in the scalp and will ultimately lead to new hair formation. Most of the rest of the transplanted hairs will fall out between 2 and 5 weeks after surgery. As soon as 4 months after surgery, new hair shafts will begin to grow, and they'll grow at a normal rate of approximately ½ an inch per month. It will take 8 to 12 months for most of the hairs to grow in. Occasionally, it can take upwards of 16 to 18 months to see the final result of the hair transplant procedure.
If you were using topical minoxidil before your surgery, we usually like for you to stop for 2 weeks in order for your scalp to fully recover. After the 2 weeks, you can resume the topical minoxidil. If you have any redness or any inflammation, you stop for another week, and then you slowly reintroduce it to your system by applying it every other day. If you were using a minoxidil in the pill form, then there is no need to stop your medication.
Some of the most common questions that we get are, when can I get a haircut after a transplant? And as far as the donor, you can get a fade or a shape up, etc. 5 days after the procedure, after your hair transplant. As far as the recipient area, which is the grafted area, we recommend waiting 3 weeks. The patient sometimes has hair in the area, and so they want to style it or comb it. We recommend not using a comb for, at the minimum, 5 days. But if you really want to fix things and make yourself look a little bit more appropriate, we say you can use a comb, but just right over the scalp. Do not bring the comb down and rub the scalp with the comb, because this will create an accident and you can pull your grafts out.
So how can you accelerate healing after surgery? One way is with low-level laser light therapy. Some of these machines don't actually actually touch the scalp, so you can start doing those on postoperative day number 1. But for the helmets that actually sit on your scalp, it's best to wait at least 6 days after the transplant before you start using them. Another option is PRP, or platelet-rich plasma. We often combine this with our hair transplants for optimal results. But the treatment can also be repeated at 3 months after surgery, 6 months, 9 months. All of that can also enhance results.
Now, one other question that we get a lot is, I see pimples on my head. Is this normal? The answer is yes. This can occur both in the recipient and donor area. What we recommend you do when this happens is to do some warm compresses to the area and or apply an antibiotic ointment several times a day. And this will help resolve the pimple in a few days. Don't pick the pimple because this can cause irritation, an open wound, etc. So we want to make sure we avoid that. If it proceeds and it's not getting better, then we would want you to reach out to us, your providers, for us to be able to help you resolve it with some medication.
So when can you color your hair after hair transplantation surgery? You can color your hair 3 weeks after a hair transplantation surgery.
Emergencies after hair transplant surgery are highly uncommon. However, you have to be aware of concerning signs and symptoms for which you should call your doctor, the clinic, or emergency services. These signs and symptoms include, but are not limited to, increasing pain, swelling, bleeding, darkening of the skin, fever, shortness of breath, or chest pain.